The dangers and treatment of swallowed magnets. The plain film radiographs demonstrate a linear arrangement of 9 small magnetic spheres within the abdomen. These findings are consistent with a partial small bowel obstruction and the onset of ileus. The ingestion of magnets, particularly those composed of rare earth metals, poses a significant health risk with potentially high morbidity and mortality rates. This comprehensive overview aims to elucidate the dangers associated with magnet ingestion, the mechanisms of injury, and the risk factors that healthcare professionals should be aware of when managing such cases. Mechanisms of injury. This 3-year-old boy was admitted to the emergency department with a history of magnet ingestion 5 to 6 hours prior. A plain radiograph of the chest and abdomen revealed a string of 23 connected metallic balls in the stomach region. When more than one magnet or a magnet and another metallic object are ingested, they can become stuck together through walls in the GI tract, creating a risk for obstruction, erosion, fistula formation, and perforation. It's crucial to note that the advent of newer magnetic materials has exacerbated these risks. Magnets containing boron, iron, and neodymium exhibit magnetic fields 5 to 10 times stronger than traditional iron magnets, significantly increasing the potential for tissue damage. Clinical presentation and diagnosis. One of the challenging aspects of magnet ingestion is that symptoms may not manifest immediately. In fact, clinical signs can appear days after the initial ingestion event. This delay in symptom onset can lead to misdiagnoses and delayed interventions, potentially worsening outcomes. Healthcare providers should maintain a high index of suspicion, especially in pediatric cases or in patients with a history of pica or psychiatric disorders. High-risk features. Several factors can increase the severity and complexity of magnet ingestion cases. 1. Concomitant ingestion of sharp objects. The combination of a magnet and a sharp metallic object significantly elevates the risk of perforation and tissue damage. 2. Multiple magnet ingestion. A higher number of ingested magnets increases the likelihood of complications due to the potential for multiple attraction points within the GI tract. 3. Extended ingestion period. When magnets are ingested over a longer interval, they may be distributed throughout different segments of the GI tract, complicating management and increasing the risk of interbowel attraction. 4. Esophageal localization. The presence of multiple magnets in the esophagus raises concerns about potential aspiration into the airway, adding respiratory complications to the existing GI risks. Management considerations. Given the potential for severe complications, prompt recognition and appropriate management of magnet ingestion cases are crucial. Key considerations include: 1. Immediate radiographic evaluation to determine the number and location of ingested magnets. 2. Serial imaging to monitor the progression and potential attraction of magnets within the GI tract. 3. Early endoscopic intervention, especially for magnets located in the upper GI tract or when complications are suspected. 4. Surgical consultation. In cases where endoscopic removal is not feasible or when signs of perforation or obstruction are present. 5. Close monitoring, even in asymptomatic patients, due to the potential for delayed onset of complications. In this case, the X-ray showed that the magnetic foreign bodies were in the left upper abdomen, and gastroscope was performed to remove the foreign bodies in the stomach. However, there were remaining foreign bodies remain in the same position on sequential abdominal X-rays. Surgical intervention is required in this case. Risks of ingested magnets. This 13-year-old healthy child was referred with a 12-day history of epigastric pain following the inadvertent ingestion of 2 round magnets. Radiographic inspection on the first day demonstrated 2 separate foreign bodies in the lower esophagus and gastric fundus, which did not pass spontaneously after 3 days of follow-up. Upper gastrointestinal endoscopy on the fourth day revealed the formation of an esophagogastric fistula, but conventional endoscopic methods failed to remove the impacted magnets after repeated attempts. The primary concern with magnet ingestion arises when multiple magnets or a combination of a magnet and another metallic object are consumed. These objects can attract each other through the walls of the gastrointestinal tract, leading to a cascade of serious complications. The potential adverse outcomes include 1. Perforation, a hole forming in the digestive tract, allowing leakage of gut contents into the abdomen, which can cause infection and sepsis. 2. Obstruction. Magnets can cause a mechanical blockage in the GI tract, impeding the normal passage of intestinal contents. 3. Necrosis. Tissue death due to lack of blood supply caused by the magnets pinching blood vessels. 4. Fistula formation. Prolonged pressure between 2 points in the GI tract can result in abnormal connections or passageways between 2 organs, between an organ and the skin, or between organs or vessels. In conclusion, magnet ingestion represents a significant medical challenge with the potential for severe, life-threatening complications. Healthcare professionals must be vigilant in recognizing the risks associated with these cases, particularly given the increased strength of modern magnetic materials and the possibility of delayed symptom onset. A proactive, multidisciplinary approach to management is essential to mitigate the risks and improve outcomes in patients who have ingested magnets. Question 1. Which of the following is not a potential complication of magnet ingestion? A. Perforation. B. Obstruction. C. Fistula formation. D. Heavy metal intoxication. The correct answer is D. Note that potential complications of magnet ingestion include perforation, obstruction, necrosis, and fistula formation. Question 2. These are high-risk features in magnet ingestion, except A. Concomitant ingestion of sharp objects. B. Ingestion of a single large magnet. C. A longer interval over which the magnets were ingested. D. Multiple magnets in the esophagus. The correct answer is B. High-risk features in magnet ingestion include concomitant ingestion of sharp objects, multiple magnet ingestion, extended ingestion period, and esophageal localization.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.